Hi, I'm Lani Valencia Jones, professor in the School of Social Work at the University at Albany, State University in New York. And I'm happy to share with you my thoughts on the paradox between whether or not Black women's mental health matters in America. I'm hoping this will be useful for all social workers and all human service providers, and grateful for this opportunity by the Society for Social Work Research. I am the first and the last. I am the honored one and the scorned one. I am the whore and the holy one. I am the wife and the virgin. I am the barren one, and many are my daughters. I am the silence that you cannot understand. I am the utterance of my name, Julie Dash. Many Black women today carry the weight of centuries of adversity, beginning with the stark exploitation of African peoples for more than 250 years of slavery and extending through the post slavery era of Jim Crow into present day institutionalized racism, sexism, classism, and heterosexism. Throughout these eras, Black women's social, political, and economic contributions to the United States have been undercompensated and undervalued. So now let's look a little bit closer at this, what I call a paradox. Black women are among the most likely to be affected by adverse social, emotional, political, and economic conditions, such as poverty, underemployment, joblessness, incarceration, homelessness, and lack of access to basic health care, including mental health care. Black women have lower rates of health insurance coverage compared to their white female counterparts. And when they do receive health care, including mental health care, their quality of life is lower than that of white women and men. Black women experience higher poverty rates and are paid less than their white counterparts for the same damn work. So listen carefully, because here the paradox collides pretty quickly. Proportionately, Black women are enrolled in college at higher rates than any other racial and or gender group. However, recent data tells us that at all educational levels, Black women are concentrated in lower paying jobs compared to Black men, white men, and women, even with college degrees. So, what we know here is that racism and anti Blackness, or the systems of dominance, power, and oppression based on socially constructed racial and gender hierarchies, have dire consequences for Black women, their mental and physical health, as well as safety. Over the past years, I've conducted a number of focus groups, and I'll share some of their words with you. We got two things going on, the mental health thing and the pandemic. Here comes your health. So it would be helpful to have a little compassion about it. Don't put labels on us. Everybody's got a label. Oh, that's a crackhead. Oh, that's an addict. Oh, she got HIV, or she got mental health problems. What I'm just saying here is that she's on welfare. Or she ain't never gonna be nobody. We got to stop that. Stop labeling people, and people got to stop accepting those labels. End quote. Another consumer shared, based on her experience with the service provider, quote, service providers look at Black people thinking we're all addicts or think that we're all mentally ill. When you come in all broken down, looking bad, and the receptionist gives you that looks and turns her head as she didn't see you, and you're just looking for help. That's all. You're just looking for help. End quote. And another, I was just going crazy. They wouldn't do nothing for me, and they didn't think my issues were important enough. And that's when I said, I'm going to kill myself. I wasn't going to kill myself. I just wanted them to know that what the hell I was going through. You just have to let them know that you take your mental health serious too. And lastly, as one consumer stated, quote, I think that when you go looking for mental health help, basically you go with an idea of the kind of help you want. So you expect that the counselor who gets your case gives you a different approach. One you can relate to as a woman, as a Black woman, not necessarily medication, but like, holistic approach or stress relief program. What about meditation or based on you as a Black woman? But most therapists can't relate to you because culturally they don't know or they cannot understand what you went through or where you're coming from. So they don't get into details. They basically don't know what to offer. They could offer more, but basically they give you prescription, think that problems will go all away. So let's talk about the Black feminist perspective a bit as a means of breaking or shifting this paradoxical dilemma about whether or not Black women's mental health and wellness are important. The Black feminist perspective is a lens through which mental health therapists can better understand, acknowledge, and intervene with Black women on the basis of their life experiences. Black feminist therapeutic perspectives are offered as an alternative to traditional mental health frameworks that view Black women as others and whiteness, maleness, or heterosexuality and middle class status as the norm. Black feminist approaches thereby goes and understands Black women's life situations from a model of pathology to one of wellness. These norms have resulted in biased psychological frameworks and therapeutic treatment modalities that consistently fail to acknowledge experiences that differ from dominant patriarchal white middle class perspective. Hence, Black feminist therapy evolved as a means to empower all marginalized women, in particular women of color who often felt silenced or oppressed by mainstream therapy. So, Black feminist perspective of mental health is derived from sociological and psychological theories for viewing Black women's functioning, drawing from fields such as psychodynamic psychology, cognitive and behavioral narrative, person and environment, anthropology, interpersonal, and other developmental theories. The development and delivery of mental health services from a Black feminist lens incorporates the client's beliefs, values, and assumptions based on how the therapist experiences and interprets the client's psychosocial realities, as well as their challenges and strengths. So, this lens represents an intellectual and practical effort that draws on a rich cultural legacy, a racial consciousness, and a history that positions the reality of Black women at the center of the therapeutic intervention. Consequently, the Black feminist lens helps therapists become more cognizant of life experiences, more self reflective about their own limitations and knowledge and experiences, and ultimately, it acknowledges the diversity and the experience of women who have experienced systematic oppression. So, here, in the assumption of the Black feminist lens is that therapists engage in a process of observing and experiencing Black women in their natural environments and in their social, cultural, political, and economic reality. This may be done by becoming culturally aware. Perhaps one schedules a home visit with a family or attends a religious or cultural event that allows you to meet the family or others within the community, and also gaining a in-depth narrative of the intersection of identities faced by these Black women. To work competently with Black women, therapists need to have some familiarity with the culture and lifestyles of the client. In other words, they need to be culturally aware and competent. Moreover, to do ethical and effective therapy with Black feminists, therapists need to understand the societal challenges Black women face in their daily lives. So I offer this caveat that I'm not attempting here to describe the cultural concerns of all Black women. Moreover, I believe it's important that therapists sensitively assess the degree to which these issues are salient for any particular woman, in particular, Black women with whom they are working. This enables the therapists of all races and of all cultural bounds, whether that therapist is male or female, to place themselves in the standpoint or the eyeglass of the client. This lens is primary space for which therapists and clients formulate the therapeutic assessment, treatment plan, and goals. So once a therapist is committed to this lens, a shift will occur for both the client and the provider, attitudinally and behaviorally. So Black women's mental health and wellness and liberation does matter. Thank you.